Hi friends, this is Prabir Kundu once again before you with a new episode of a video on a very sensitive and emotional subject. You know I love speaking on emotions, okay? Fine. See, whenever any patient or we as patient goes to doctor for to reduce our suffering, maybe because of any chronic or acute disease, or we get admitted to the hospital to get recovered from our illness, huh? Or from the chronic illness or acute illness, or we get admitted to the nursing homes or a hospital for a surgery, or we get admitted for a chemo as a patient. What as a patient people or we expect from the medical fraternity. मेडिकल फ्रेटर्निटी बोले तो डॉक्टर्स से, पैरामेडिकल स्टाफ से, नर्सेस से, हॉस्पिटल एडमिनिस्ट्रेशन से. हाँ, आप बोलेंगे क्या वो तो डॉक्टर के पास गए तो डॉक्टर विल treat them, doctor will give the medication, doctor will give the medicine, that's right. Okay, and if the patient get admitted into the hospital for treatment for any acute or chronic illness, so they will be taken care of as per the hospital authorities and the paramedical staff. So what is what is wrong with that? Everything is okay. No, as the patient, when we go to the doctors or when we go to hospital or when we go to the nursing home, as a patient, we look forward for lot of things other than the medication, other than the treatment, and other than our recovery. That is a big purpose. Without that, we should no one will visit to the doctor, no one will visit to the nursing home, or no one will visit to the hospital. Now let us see under what condition anybody visit doctor, visit nursing home, visit hospital. See, whenever anybody, including me, including you or anyone, they are in a mode of suffering. They are suffering because of some illness. They are suffering because of some surgery need to be done. They are suffering because of certain very chronic disease. Then during the stage of suffering, inside our body, what happens? We have developed anxiety, we develop anger, we develop depression, we develop frustration. So all this development inside of the body that comes along with the disease, it helps to release more and more of the cortisol and hormone. Okay, the happiness hormone, that is those dopamine, oxytocin, serotonin or endorphin, which helps us to keep in our very good mood, that all get disappeared. And what is produced more and more inside the body because of our suffering, because of our illness, is more and more of the cortisol hormone, which is a negative and harmful hormone. And the more and the more the release of the cortisol will be there, the more and more will be the anxiety, the more and more patient will have a depression, the more and more patient will have a suffering, the more and more the patient will have a pain. So all these things will be more and more. Okay, and all these things need to be treated at the same time along with the medication and treatment, right? Now for doctor, whosoever visit to him is a patient. For hospital, whosoever get admitted is a patient. For nursing home, whosoever get admitted is a is a patient only. For them it is a routine thing. What is very abnormal for us, what is the very abnormal condition? Suffering is an abnormal condition. So what is an abnormal condition for a patient, or for we people as a patient, is a very normal condition for the paramedical staff or for the doctor. And here lies the crux point. Okay, see, they are surrounded with the sufferings only. All the patients who are admitted in the hospital, or all the patients who are visiting the doctor, they have their problems, they have their illness, they have their disease. Okay, so they will deal it accordingly, but that's not the enough. Because imagine a situation that some patient is being admitted in a hospital, and around that another 7-8 patient is also there in the room. So some patient is having one problem, he is crying. Some patient is having a pain in the abdomen, he is also asking for the relief. Somebody is having some another problem, and the paramedical staff or the doctor who is RMO, who is attending all this patient, for them it is a regular feature because it happens every day. But the patient who are being admitted over there, for them it is not a regular feature. For them it is, it comes maybe once or maybe twice or maybe thrice. It is an abnormal feature which they are having the suffering, they are having the anxiety, they are having the depression, and the more and the more cortisol is there. Okay, so what is need to be done? What is the expectation for this patient from this paramedical staff or from the doctor, and in addition to the medical treatment or diagnosis or whatever it is, that they need to be dealt in a very, very empathetic manner. See, one condition is that in a ward there are some 10 patient is there, and everybody is having some problem, everybody is crying for some help, and the paramedical staff or the RMO, for them it is a routine case and they are not giving any attention. So what will happen? The kind of the empathy they need to be taken care of by those paramedical staff or by the RMO for the patient will be missing. And it will increase more and more agony, it will increase more and more suffering, it will increase more and more pain, and this will definitely have a tremendous impact inside the mind, inside the heart of the patient, and which will certainly delay or certainly accelerate the rate of the recovery of the patient, because it has a lot of the more and more cortisol will flow because of the maybe the rude behavior, or maybe not attending properly with the patient will give increase to more and more of the cortisol. So the more and the more of cortisol, which is a negative hormone, will produce more and more of the anxiety, will more and more produce of the frustration, will more and more produce the depression. So in spite of the medication, in spite of the treatment, this will also have a negative effect and it will delay the process of the recovery. So what is needed? What is needed and what distinguishes from a top practicing doctor or a top practicing hospital or a top practicing nursing home is that their paramedical staff and their doctors need to be highly emotionally intelligent. In spite of that, they may be tired, they may not have slept earlier night because of some problem of some of the patient. Yes, still, if someone patient is crying, they have to take control of their negative emotion that is coming. They might feel irritated, but they have to control their negative emotion, and they have to regulate themselves, and they need to be empathetic to each and every patient, whether it is a doctor or whether it is a paramedical staff, and need to be dealt in a very, very compassionate way with the patient. So their self-awareness and their self-regulation and their empathy and their compassion, and also their motivation by which they can help the patients to get motivated that nothing is this, I am with you, we are all along, standing with you, you will recover very fast. This all compassionate word, this all empathetic approach will certainly help to recover the patient, and patient will also feel in that he is in between his own people. He will feel good, he will feel pleasant, and under this condition, from his body, the endorphin, the serotonin, the oxytocin and dopamine, which was absolutely missing, will start producing, which will start giving a good sense of healing, which will correct his mood to the happiness, and it will also have a tremendous effect in the recovery of the patient. And when patient leaves the hospital, or when patient leaves the nursing home, or when patient leaves the doctor, he will leave the hospital or nursing home or the doctor with a very, very smiling face, with a very, very smiling attitude, and with a vow that whenever I will have any problem, I will once again revisit this hospital, I will once again revisit this nursing home, I will once again revisit this doctor, because these are the people who had taken care of me in the best possible way and kept me in a nice mood. And this thing had nothing to do with the doctor's talent, with the doctor's degree, and with his capability of the diagnosis. So it is very, very important, for having the maximum ROI for the hospital, or maximum ROI of the nursing home, or the maximum practice of the doctor, that they should be highly emotionally intelligent, and they should be well versed that how empathetically, how in a compassionate manner, how in a motivating to the patient, they can ensure that the patient who because of the suffering have a lot of cortisol hormone, a negative hormone flowing inside body, they can correct back that the endothelin hormone, which is serotonin, the oxytocin, they start flowing in the body, and the patient from inside, they start feeling good, and it will help. They know that they can do it happen with their behavior, they can do it happen with their empathetic approach, they can do it there with their compassionate approach, and it will help to recover the patient much faster, and it will bring reputation, it will bring good name, it will bring good favor, from the class of the society. So what the point I wanted to drive through my video is that all the paramedical staff, irrespective of hospital or irrespective of nursing home, or all the doctors, in spite of their best education, in spite of their best degrees, they should be needed. It is the need of the hour in the tough competition, even in the healthcare segment, that these people should be highly emotionally intelligent, and they should be well aware of their, have a self-awareness, so that understand their negative emotions, and they can put a check on that by developing the self-regulation. They need to be very, very empathetic, irrespective of what kind of condition they are themselves going. They need to be very, very compassionate towards the patient because they are suffering, and they should keep on continuously motivating for the patient, which will definitely add not only reputation to these people, but to their management also, but to their institution also, which will definitely increase the revenue return many, many fold. Right? So emotional intelligence is the topmost priority for every doctor, for every paramedical staff, to be on the top of the reputation. Thank you so much, friend. Thanks a lot.